Okay, in this assignment, we are discussing Joshua, who is a 40-year-old male that presents to the clinic with complaints of right shoulder pain. We know his pain started 2 nights ago and that he is a welder, and that he is overall healthy. Some questions I would ask Joshua is, when did the pain start? He did tell us it was 2 days ago. How bad is the pain on a scale of 0 to 10? Did the pain appear suddenly or was it gradual? Is the pain radiating anywhere? What happened that caused the pain? Is the pain stopping you from activities of daily living? Has there been any swelling or a discoloration? Does anything help the pain? Does anything make the pain worse? Have you taken any medications for the pain? Have you experienced pain like this before? And do you have a history of any shoulder injuries or surgeries? So further testing and treatment would include x-rays, which produce images of internal tissues and bones. An arthrogram is an x-ray followed by an injection, or it's following an injection of contrast fluid. Let's see, an MRI, which takes pictures of inside the body, a CT scan that produces more images, and ultrasound that can produce images of structure inside the body. So getting those tests done would tell us more about what's going on inside of the shoulder that could possibly be causing the pain. One possible diagnosis is rotator cuff tendonitis. This is the swelling of the tendons connecting to the muscle and bones of the shoulder. It is found that an occupation that requires heavy lifting or repetitive movements above shoulder level can increase your risk for rotator cuff tendonitis. In this case, where Joshua is a welder, I can assume that he's probably doing repetitive movements on a daily basis. So this makes me think that he is at a high risk, that it could possibly be rotator cuff tendonitis. Rest, ice, and pain relievers can help with the pain. And then in severe cases, physical therapy and steroid injections may be required. Another common cause of shoulder pain is shoulder bursitis. This is when the bursa is inflamed, causing pain. Bursitis can be caused by too much stress on the bursa, or it can be an infected bursa with, a bacteria, or a traumatic injury to the bursa. Treatment includes anti-inflammatory medications, ice, and possible steroid injections. Sometimes a provider can reduce some of the fluid in the bursa, just like sticking a syringe in and taking some of it out, and that has been shown to help reduce pain. So overall, these are the 2 diagnoses that I think would apply to Joshua. I am definitely leaning more towards the rotator cuff tendonitis. It's very common, and just because it's seen in occupations where you have the repetitive movement and heavy lifting, makes me have a high suspicion that that could be his diagnosis. Thank you.